Hi, welcome back. Once again, this is Dr. Richard Herbold, board-certified chiropractic neurologist and clinical nutritionist. So today I want to talk a little bit about a condition called fibromyalgia. And if you're suffering with fibromyalgia, I have deep regrets in that I know it's a very significant condition, and no part of this conversation is meant to demean what fibromyalgia is. The discussion at hand is really to qualify that fibromyalgia is really a description of a condition, but not necessarily a disease process, because it's not. It's a metabolic crisis. And what I mean by that is that the impairment in fibromyalgia is really a lack of ability to generate energy successfully. And that portion of the cell called the mitochondria is starting to choke and die, just like strangling somebody. So the mitochondria is an organelle. It's a little piece of a cell, and it's kind of like the powerhouse or the energy production center. And mitochondria are the highest in density in muscles and in nerve fibers and different tissues. So when we think about this muscular phenomenon that's being treated now with antidepressants, because pain fibers are related to serotonin production, which is a neurotransmitter. So this off-the-label treatment of fibromyalgia and peripheral neuropathy and things of that nature with antidepressants is effective as far as handling symptoms, but it does nothing for the condition itself. So sticking really with fibromyalgia as a discussion, understand that when you're suffering with fibromyalgia or those symptoms, which in essence is if I were to stick my big fat thumbs in 11 of 18 points and make you go, ow, I'm pretty good at doing that. I could probably find this type of a situation on many, many people who don't even qualify with the diagnosis of fibromyalgia, but there's no muscle biopsy that proves fibromyalgia. There's no blood test that proves fibromyalgia. In essence, once again, this is a metabolic crisis. Using the background of the approach that we take in the office to enhance and restore metabolic function, and what I mean by that is basically energy production, is really the route of success for people to turn around fibromyalgia. You can cover it up with all sorts of medications, including antidepressants, increasing serotonin production, but you can also increase serotonin production with neurological techniques and exercises and metabolic changes to have a far superior effect with people instead of just covering up the symptoms. So I hope that's helpful in contextualizing fibromyalgia, and I hope you enjoy the rest of your day. Once again, this is Dr. Richard Herbold. Thank you for joining me again.